Welcome back to VetCare. Today, we're going to talk, the descent of the testes. The testes are formed, near the ribs, in a retroperitoneal position. A retroperitoneal position is when an organ is located behind the peritoneum, the lining of the abdominal cavity, rather than within the abdominal cavity itself. During fetal development, they must move a long distance to reach the scrotum, where they will function after birth. This journey is guided by a ligamentous structure called the gubernaculum, which changes in size and shape during the descent. At the same time, layers of peritoneum surrounding the testes travel with them. The process of testicular descent can be divided into 4 distinct phases. The first is the transabdominal phase. At this stage, the testes lie in their retroperitoneal position, attached at their caudal end to the gubernaculum. The gubernaculum extends caudally toward the area that will become the scrotum. As the fetal body grows, the testes are gently pushed against the peritoneum. This pressure makes the peritoneum wrap around the gubernaculum and the testes. This phase is primarily controlled by a hormone called Insulin-like 3. The second phase is the gubernacular growth phase. Here, the distal part of the gubernaculum undergoes rapid growth into the future scrotal region. This growth creates the mechanical force that pulls the testes toward the inguinal canal. This phase depends on androgens, particularly testosterone, for proper development. Next comes the inguinal passage phase, during which the testes begin to move through the inguinal canal. This movement is facilitated by the shrinkage of the gubernaculum and possibly by the pressure from the growing abdominal organs. During this time, the peritoneum wraps around the testis and gubernaculum. The testes are held near the inguinal canal and are slowly guided downward into the scrotum. Finally, we have the scrotal phase, the last step of descent. The gubernaculum continues to shrink, pulling the testes fully into the scrotum. The peritoneum now forms the complete vaginal tunics, the visceral vaginal tunic covering the testis, epididymis, and spermatic cord, and the parietal vaginal tunic forming a fold just outside the visceral layer. The space between these 2 layers is called the vaginal cavity, and it remains continuous with the abdominal cavity. These layers are slippery, allowing the testes to move freely within the scrotum. Once the testes have fully descended, the gubernaculum regresses into a small knot at the bottom of the scrotum, anchoring the testis in place. Any disruption in this process can result in cryptorchidism, which is an important condition to recognize in veterinary practice. We will discuss this in our next upcoming video. Thanks for watching. Make sure to like, subscribe, and hit the notification bell for VetCare.